Tonight, in the Alfred Hospital's intensive care unit.
Had a bad accident.
Fortunately, he's still here with us today, because not everyone survives this injury.
You really only have to go through it once.
Black is good, and it's not enough black in those lungs to make us happy. This is a genuine setback and disappointment.
Just one stage at a time.
That looks like a very severe brain injury.
She's 5 out of 5 in terms of severity.
As a priority, we'll make sure she's comfortable, and after that, it's just a matter of time.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death. In the trauma pod of the Alfred's intensive care unit, Kevin is keeping the team on its toes.
Very sorry.
His wife, Sue, knew something was wrong when Kevin didn't come home from work.
By 7:15, I rang Desiree and I said, I don't mean to alarm you, but your father's not home. Desiree said, oh, I'll have a look and see if there's been any accidents. So just when I hung up from her, the ambos rang to say he was here at the Alfred.
At the Alfred, there was more bad news.
Then the doctor came in and said how serious he was. I'm sure he said something like only a 35% chance.
Kevin, my name's David. You're in the intensive care at the moment. Had a bad accident.
He was on his bike, was hit by a car, and it looks like he's gone over, put his arms out to actually protect himself, and then sustained an awful lot of injuries. He's broken both wrists. He's had injuries to his spine and got significant fractures of the vertebral bodies in the middle of his back and some more minor fractures of the backbone higher up in his neck. He's had significant injuries of the abdomen, had some tearing of the sort of lining of the bowel, and also had a very serious fracture of the pelvis.
Kevin had emergency surgery on his broken pelvis and another operation to seal a severed artery in his abdomen.
We put an external frame on his pelvis to try and slow down the bleeding in his pelvis. So fortunately, he's still here with us today, because not everyone survives this injury. It's a life-threatening injury.
This is Kevin's first accident in 50 years of riding motorbikes.
He loved riding the bike. He wasn't a bikie or anything like that. He just loved his bike, and it was a pleasure for him to be able to ride it. I have to say, I never got on the bike.
Kevin, can you wiggle your toes for me? Excellent. Can you wiggle your fingers?
He'll need more surgery for his wrists. But Kevin's also got major problems with his fractured spine and his lungs.
We can't get him set up because we can't work out what to do with his spine.
That's right. His white cell count was down to 3. What could that be from?
Brewing sepsis, probably. The longer he lies flat, the more risk he's got of developing pneumonia, and we're concerned that he's starting to develop a pneumonia at the moment.
Doctors need to quickly stabilise Kevin's spine and get him sitting up before his lungs cause serious problems. In the cardiothoracic pod of the ICU, the team is keeping a close watch over 13-year-old Catrice, who's had a difficult lung transplant.
She's looking great.
Catrice has had a rough trot medically.
Catrice was born with Down syndrome, and early in her life she became breathless, and she was actually found to have a cardiac disease and underwent cardiac surgery. And it was only during her recovery that she was still breathless that people then realised that she had lung fibrosis. And here she is now 13 years on, where she was extremely breathless, dependent upon oxygen, and it became appropriate that she be considered for a lung transplant.
Over the years, it's got tougher for her. All this year, she's actually been pretty much wheelchair-bound.
But Catrice is a little battler.
She'll tolerate whatever she possibly can. Like, she used to go swimming with oxygen nasal prongs in, but a little thing like a cold could set her back weeks.
Catrice's lung transplant wasn't easy. Because of congenital heart disease, her heart was missing an essential piece of plumbing. The main vein that feeds oxygen from the lung back to the heart never developed, so surgeons had to join the vein from the donor lung directly to Catrice's heart.
I think she's doing well. It's early stages yet. We're not going to rush her. When we wake her up, probably tomorrow, we'll see if she'll breathe properly for us. And at that stage, hopefully, we'll get the breathing tube out.
In a nearby cubicle, 60-year-old Judy has been brought up from emergency after crashing her car.
Judy had a car accident which we believe was caused by a sudden and severe brain hemorrhage. As a result of that, her heart stopped and her breathing stopped at the scene of the accident, and she's been brought in here to determine what's the best thing we can do.
Mum's had a very severe bleed to the brain and very severe damage. When they explain it to you, it's on the scale of, she's 5 out of 5 in terms of severity.
This is a real shock. This particular condition was caused by a ruptured aneurysm on the arteries in the brain. It's called a berry aneurysm. She's probably had that for many years, and it's probably been slowly growing in size until it reached a point where it burst. Sometimes there's warning symptoms like a headache, but these things usually strike out of the blue. So somebody can be well 1 minute and the next minute severely unwell.
One thing about Mum is that she lived life to the fullest. She played golf 3 times a week. She played bridge. She was on the boards. She was, you know, just the most lively, fit and healthy person. And she's been struck down by, you know, a complete random aneurysm that's, you know, nothing can prepare anyone for anything like this.
The first CT scans of Judy's brain are devastating.
The scan results show severe hemorrhage. Normally these spaces here are quite black and quite small. Here you can see they're quite white, suggesting there's blood, and we can also see that the brain is very swollen. We can't look at a CT scan and say that alone will tell us the prognosis, but that looks like a very severe brain injury, and we'd be very concerned that this person would have a poor outcome. That is, it's not going to have any meaningful recovery. That means we'll never regain consciousness and know who she is or where she is or recognise her loved ones.
A lot of people are texting and calling and saying, you know, I hope, you know, your mum has a speedy recovery, and the hardest thing for us is to say, you know what, it's not about a speedy recovery.
In the Alfred Hospital's intensive care unit, it's 24 hours since Catrice got her new lungs, and they appear to be working a treat.
Josh has been with you?
She told us on the phone she's been extubated.
Exactly. Catrice woke up this morning and was impatient and wasn't even willing to wait until her family came in. And the ICU staff took the tube out, took her off the ventilator an hour ago, and it was a surprise to me. It's even more of a surprise to the family.
And did you say thank you to Dr. Glenn for your new lungs?
They did, yeah.
That's quite all right, Catrice. You're doing really well. We're going to have you up on the ward pretty soon.
You want to hug, what, Dr. Glenn?
Yeah.
OK. I'm sure he'd love to give you a hug.
I'm always up for a hug.
You all right?
Well done. You've done really well. We're very, very proud of you.
But kids can go downhill fast, and just a few hours later, Catrice's oxygen levels have taken a dive.
This is a genuine setback and disappointment. Disappointing.
Coleman's baffled as to why Catrice deteriorated so quickly.
Up here at the top of the lungs, that looks pretty normal. As we go down towards the base of the lungs, the diaphragm across here. Black is good, and it's not enough black in those lungs to make us happy. But in itself isn't diagnostic of anything in particular. So we put a breathing tube back in based on her clinical state and the finding of the X-ray, and then we'll just take it from there.
With Catrice, she has to do things in her own time with pretty much everything she does. I don't think anyone was really sure what actually happened, but it's like a snowball effect. She went down, all the alarms started going off, which frightened her even further. The doctors all come in, which again frightened her and that. So they decided to put the tube back in, which was probably the safest measure to do. I was actually holding her mask on when they're actually putting her back to sleep. And that, and I mean, it's horrible as a parent having to do that, but also it was calming her down as well. I'm here, so this is all going to be all right. We're going to put you back to sleep and you're going to be fine, sort of thing, So it's trying to calm her down in that and making things work for her as well. She sends these little hiccups and hurdles to us all the time, don't you, darling?
Just one stage at a time?
Yep.
It's now 6 days since Kevin came to grief on his motorbike.
On Friday night it's Melbourne and Essendon. So do you want to go for Melbourne? No. Or Essendon? Essendon. The update today is he's had a back brace put on and he's now able to be sat up, which means that the muck that's in his lungs and chest is now able to expel itself, so he's had the sedation cut dramatically, so he's awake now. And then on Saturday, Sydney and Collingwood. Sydney, so there you go. And your blood pressure's gone up again, so we'll just settle down.
Kevin put his hands out when he went over the handlebars and broke his wrists in a dozen places. Now that he's stabilised, surgeons can take him back to theatre and start piecing the fragments together.
Big brave boy.
So Kevin's about to go off to theatre in about 5 or 10 minutes just to get the 2 wrists fixed again. So they'll just take the metal off the outside that you can see there and internally fix it. So hopefully when he gets back, he'll have a little bit more movement in his hands and be a bit more comfortable. I'll see you back tomorrow morning, all right?
It's 3 days since 60-year-old Judy had a catastrophic bleed in the brain. Her distraught family has kept a vigil by her bed. Judy's son Richard keeps thinking of another time in another hospital. In 2003, Richard was terribly sick with kidney disease.
My mother was the first one to put up her hand. My mother was compatible with me. The transplant took place, and it has been pretty much a success from day one. She has been so supportive, and she had to endure immense pain. Immense pain.
But there's nothing Richard can do to make Judy better. Her brain injury is severe and irreversible.
Judy has been examined by 3 people who are experts in this, and we've all agreed that her outlook is hopeless. We have a duty to do whatever we can, but once there's no longer any chance of a recovery that's of any value to the patient, we have a similar duty to stop treatment that is basically futile and in the end unkind.
What's giving Judy's family strength is the hope that something good can come from this tragedy.
The family know that she was an avid supporter of organ donation, and we are currently going through that process, knowing that that was what she wanted.
For Richard and the family, that would make Judy's passing just a little easier.
If there's any good to come out of what we're about to do, if this somehow affects people's minds and see how vital organ donation is to so many other people's lives, that's what my mother would like to be renowned as. That is her legacy.
We were kind of planning on having a lazy day.
Just 6 days after a transplant, it's a relief to everyone that Catrice has bounced back. And with her breathing tube out, she's winning hearts.
They've actually taken the tube out today because they thought they've just watched her slowly progress over the last couple of days, and that, and things have actually got better.
Been coughing at all?
Yeah?
And with lung transplants, it's very important that they're able to cough things up.
Yeah. Can you show me how you're coughing?
Big one, big one.
Yeah, try and make it a really big one, nice and strong. Yeah.
Oh, that's a good one.
I'm tough.
Of course you're tough. Very tough, yeah.
I'm tough kid. You are a real tough kid, yes. She's doing really good today and it's all looking good. And hopefully we won't have another episode like we had the other day. So.
Yep, wriggling, wriggling.
The team's next hurdle is to get Catrice out of bed.
A pillow behind you?
Yeah.
If Catrice keeps kicking goals, she'll progress to the ward in no time.
So you hear that?
It's good, is it?
You just have a relax today,
good,
and then we'll do it more tomorrow, okay?
Yeah. She's pleased with herself.
It's 9 days after Kevin's motorcycle accident, and it's just taken 7 hours for surgeons to fix his right wrist.
It was quite nasty. There's probably at least 10 fragments of bone that individually needed to be fixed.
Should feel my hand back together. Yeah, right, done.
If they ran out of steel, there'd be a fair bit in that hand, wouldn't there?
Yeah.
This morning he was looking great, so we took the breathing tube out, took him off the ventilator, and he's been doing fine.
Kevin knows he's lucky to be alive to see his family, but it breaks his heart that after 50 years of riding motorbikes, he's got to call it quits.
I'll never get another bike. You really only have to go through it once. It's just not worth it.
Careful's not enough sometimes, is it?
Yep, it's not often your fault. I couldn't avoid it.
Yep. Well, you got out of it the other side, didn't you?
It could have been a lot worse.
Could have been a lot worse.
Down the hall, Judy's family is meeting with intensivist David to discuss withdrawing treatment.
We'll give her some sedation before we do anything, so that when the tube comes out, she doesn't experience any shortness of breath or any discomfort. And then when we're sure she's comfortable, we'll take the tube out and we'll stop all her other support mechanisms. So it'll just be focused on her care and her comfort. And then we just see how she goes over the next little while. When her heart stops beating, if the donation's to proceed successfully, we need to sort of move her out to the theatre pretty much, you know, within a few minutes. So we'll need you to sort of say goodbye and give us space for that. I know you know that. It looks like it's being about midnight or 1 o'clock.
Yeah.
And you want to stay there up till that time?
We've said we will, but we'll see how we can cope.
Will that be quite distressing? Will it to look at during
Usually
that?
not. Usually this should be peaceful, and if it's not, we'll increase the morphine. Look, we don't expect you to leave, and we don't expect you to stay. It's up to you if you want to be there or not.
I think we want to be with Judas as
and she'll go
to say her farewell and move on.
It's hard to believe. This is Catrice, 2 weeks after a double lung transplant, in a physio session across the road from the Alfred.
Straight through the door.
Catrice is good to leave the hospital. But there's one special stop she wants to make before she goes home.
Yes. Well, guys, you came back. It's nice to see her walking now. Are you going home? Yeah. She's got awfully shy at the moment.
Hello.
Yep.
You taking Josh home? You can see how tall you actually are now.
Thanks for coming and visiting, Catrice, before you go.
Come on then.
See you soon.
Thanks for looking after us when we were down here.
Pleasure. We didn't want her to go home.
All right. See you later. Bye. See you later.
You all right?
Yeah. She's so cute.
She estimated about 1 a.m. but
1 a.m. for her extubation.
The tough decisions have been made, and soon the ICU team will withdraw all treatment and allow Judy to die.
In this case, it's just a tragedy that this event happened and she had such a devastating brain injury. But the family have come forward with their desire to go ahead with a donation process, which is a very noble thing to do, and it makes us feel very humbled by that gesture. It'll be a case of us stopping all the medication on Judy and removing her from the ventilator and taking the tube out of her mouth and extubating her. As a priority, we'll make sure she's comfortable, and after that, it's just a matter of time.
This is most probably one of the hardest things that I can imagine. The decision that the family have been through in the last 2 to 3 days has been made easier because although we are losing our loved one, it's going to be something I know that she wanted to do and felt strongly about.
She's made this process really easy for us because she was so clear in what she wanted out of life. And you know what? She never wanted to be that person lying in a bed. She never wanted to be that person who suffered from an old age disease. She wants to be remembered for that lively bubble of life and enthusiasm. She was such a lovely spirit. Our last hope of Mum and her last role in life, really, to have all of her wishes come true in this scenario, is for her to be able to pass in a way that means that every single organ in her body can be given to save the lives of others. And that's what we're hoping for now, and that's our last wish.
Next time, in the Alfred's ICU.
Open your eyes, Timothy.
Our worries would be that the pressure inside the head would get so tight that the blood supply to the brain would be cut off and the brain would die.
I'm not going to give up on him yet.
She's a 33-year-old woman with a past history of cystic fibrosis.
Putting the patient's blood back through the lung causes some inflammatory changes in the new lungs.
Being told your one and only child's going to pass away.
Definitely Damien is at a crossroad. The swine flu has definitely taken quite a hold.
He's a fighter. He won't give up.
This disease process could kill him.